And that was the news in 90 seconds. And viewers, as you can see, as you heard, I should say, we're more and more moving away from the COVID-19 pandemic, but we're still dealing with quite a lot of effects of it. Now, joining me this morning to speak on some health-related issues, especially when it comes to diabetes, we have Dr. Maxwell Adeyemi on with us, and he is a primary care physician and a public health uh, dialectologist. Did I get that right?
Diabetologist.
Diabetologist, right. So, good morning and welcome to you. How are you doing?
Good morning, Kandace. I'm fine, and good morning, Tobago.
Good. So now we're coming out of the COVID-19 pandemic, and I know one of the major concerns during the pandemic was that of the risk that diabetes patients were at with the virus circulating. I mean, just from your cursory glance, like how much did COVID-19 affect diabetes patients here in Tobago?
Well, we don't have any particular study in terms of what specific, event took place as regards to diabetes and COVID in Tobago. However, globally, the consensus is that diabetes affect COVID or COVID affect diabetes in two ways.
Mm-hmm.
One is that as a diabetic, getting COVID infection actually aggravates your risk and the chance of dying. Yeah, because that is one of the major risk factors. Okay, so being a diabetic and having COVID infection increases your risk markedly. The other flip side is that COVID being an inflammatory condition also increases the risk of developing diabetes. So a lot of persons who will have contracted COVID will have been at a higher risk of becoming diabetic. So it's a two-way thing.
Hmm.
Yeah.
And what about the long-term effects? I mean, we know we're still struggling with long COVID, and I know there's still some studies and so on going on as to, what are the longer-term effects. But I mean, from being in the healthcare system, what have you been seeing among patients who contracted COVID-19, especially those that are diabetic?
By and large, a lot of persons will have recovered.
Mm-hmm.
Okay. However, there are still complications as a result of having COVID infections that may include respiratory systems, respiratory problems. Some of them have cardiac problems. Some of them have kidney problems, But by and large, even though there is not a specific, study on this, but there will have been people who, as a result of contracting COVID, will have gone on to also develop diabetes. Yeah.
And then, I mean, we're moving away from COVID-19, but we know that diabetes is, the statistics are pretty high here in Tobago, and Trinidad and Tobago as a whole. What information do you have in terms of the data, and what is the data telling us about how prevalent it is?
Well, the data is grim and it continues to grow, a little more grimmer. I think after Barbados is Jamaica, and then after Jamaica is Trinidad in terms of the incidence of, diabetes in the population per unit population. So we're like every 1 in 8, 1 in 5 kind of range. And the irony of it is that even we said 1 in 8, there will also be, for every person who is diagnosed, at least 2 other persons that are not aware that they are diabetic. So that statistics is still there on top here.
And let's get into that a bit. How can people know that they are diabetic? What are the signs? What are the things that they need to look for?
Okay. The easiest way to know that you are diabetic or not is to test. Okay. In terms of looking for signs and symptoms, some people may not necessarily have the classic signs and symptoms. Okay, I've seen people just walking on the street and getting their blood sugar test, and it's 3 and 4 and 500, and they are very symptomatic. However, in terms of knowing what the symptoms to look for, it will include things like frequent urination, okay, what we call polyuria, okay, excessive thirst, excessive hunger, numbness or tingling sensations in your hands and feet, visual blurring, yeah, slow healing, wounds. For men, you may have erectile dysfunction. For women, you have, and men too, you will have recurrent infections because, diabetes will decrease your immune response to a lot of infections and other things. So you may have frequent infections. And so that those are the major things that you look out for.
Okay.
Yeah.
And so somebody who is diagnosed with diabetes, they should be aware that there are two types of diabetes. And can you explain the differences between them?
Yeah, there are more than two types of diabetes,
Okay.
really. But the major thing that we talk about is type 1 and type 2. Type 1 is really things that are common in children, okay, which is what they call the insulin-dependent diabetes, okay? It's as a result of autoimmune destructions of the pancreatic cells that produces insulin, such that the person is unable to, produce insulin. This is commoner in children. It could occur at any age, but most kids will come down with it anytime from around age 5, right? They may come down with it. However, we do have people being diagnosed with type 1 diabetes at 18, 19, 20, even up to 30 years, okay? But basically, it's something that is more common in children, okay? And it is total lack of insulin because of the destruction of the organ that produces the insulin, right? The other one, which is the type 2 diabetes, which is really more common in the adult setting, okay? Most people, by the time they're 35, 40, they may come down with diabetes type 2. It's an inflammatory condition, and it's usually a lot of, calorie expenditure and in intake and expenditure kind of energy discordance, okay? So you have people with overweight, excessive consumption of, sugary stuff and things like that. That, like I said, is commoner in older age group. However, because of obesity and poor lifestyle, we are also seeing those category of diabetes in children like 10, 12, 13 years old as well. Yeah?
I mean, and especially here in Tobago.
Yeah, because we eat a lot in Tobago, and most of the time we are not very energy expenditure conscious, like we don't do exercise as much. Therefore, you have that kind of imbalance between your energy intake and energy expenditure. And when that is happening, then you're going to have a lot of stored calories, which the body doesn't need. And that may put you at risk of diabetes.
And how much does the system within our healthcare, how much does the healthcare system help in us being able to treat with diabetes?
I think we have a very good and very robust system in terms of screening and even management. Okay. As to the efficiency of the system, I can't speak to that, but in terms of what is available compared to other jurisdictions, because we have a lot of health centers where people can just go in and get tested. So testing is not an issue. Okay. Getting diagnosed is not an issue because you can easily get diagnosed. And management is not an issue because, you are directed to where you can get treatment from the health centers to hospitals to private institutions. People have access to care in terms of diabetes. Now, the flip side will be the compliance of the patients that we are treating, because some of them possibly do not still either appreciate the gravity of the problem, or they're just not very compliant because of their attitude culturally or, personality-wise. So compliance is an issue. And you've seen a lot of people now, especially mango season, they come and their sugar is sky high because they've eaten about a bucket of mango overnight. And so, or there is harvest somewhere in Wim or Argyle, and everybody goes there and eat whatever they want, and their sugar is really off the roof. So that level of self-efficacy and compliance is lacking in the population, which we need to reinforce.
How much does our diet contribute to it, and what parts of our diet contributes to diabetes, and even what we can do to manage that?
Our diet, because of we eat a lot of energy stuff.
Meaning
a
starch.
lot of starchy food, which you don't need. Like a typical plate, maybe when you go to a harvest, maybe yam, cassava, rice, you know, cocoon, you know. So you might have about like 4 or 5 sources of carbohydrate on one plate. Then you're gonna have some meat, and that meat is also possibly burnt with sugar. Then when you finish, you're gonna get some juice with it, which is also laden with sugar. So in any particular meal, you might have about like 7 sources of carbohydrates, and all we need is just one, and that is the problem. So when you eat all these things that the body doesn't need, you force your body into overproduction of insulin to deal with the huge amount of glucose influx. And over time, if you consistently do that, obviously you will tire out the insulin producing cells, and they start to fail. And when they start to fail, less insulin is produced, more sugar will be in your body. You don't have enough insulin to deal with it, and therefore the blood sugar level goes up, and you become diabetic.
Why does it seem that some people can, eat and eat and eat in terms of some of these fatty foods, these very starchy foods, these very high sugar content foods, and they don't seem to be developing these health problems while other people do?
Okay, well, that brings us to the fact that diabetes is a multifactorial, disease. Okay, it could be genetic, it could be different other things that comes to play in that kind of thing. And some people just naturally have a very high metabolic rate, so maybe they are able to, deal with the blood sugar, the content of what they're eating pretty more efficiently than others. Also, it depends on the type of food they're eating, because we also have what they call a glycemic index. Certain food has higher calorie than others. So if somebody consistently eats very high calorie, and their body cannot, sustain that level of metabolic activity, then they're going to have problem. But some people may eat very low carbohydrate index foods, and maybe their body is a little more efficient in dealing with it. But you also have a lot of things, environmental and genetic factors that also play a role. Level of activity that the person has in terms of being able to expend that energy that is being consumed is also important.
Now, you mentioned earlier that, we've seen, it's mango season, and people are going crazy on the mangoes, eating like a whole bucket of mango at a time. But and while it's good to eat the natural fruit, especially the fruit that is in season within our space, how much is too much?
Well, moderation is what I preach, okay? You can, as a diabetic, even you can eat just any and any kind of food, but it's the quantity, the quantum of what you eat, your portion sizes is what is important. The nutritionist and the dietitian will let us know. You need to control your portion sizes. If you want to eat carbohydrates, your feast is your measure. So if I'm going to eat dumpling or cocoon or whatever, or rice, my feast is just the average size of what you need on your plate, and then you add other food substrates like protein and other kind of thing to support what you eat, fruit and vegetables. So whatever you want to eat, do it in moderation. If you want to eat a mango or two is enough. Don't sit down and eat a bucket of mango because it's available. Yeah.
And then in terms of, even our alcohol content and, or the alcohol that we consume, because it is part of our culture when we go on social lives and things like that, the alcohol is flowing, so to speak. How much does alcohol contribute to diabetes as well?
Right. Excessive alcohol consumption is bad for anybody, right? However, when we drink alcohol, what happens is alcohol is empty calorie. When you drink alcohol, what basically happens is that your body will abandon every other food substrate that you have and deal with that alcohol to digest and to eliminate it. So those empty calories that your body don't need will either be eliminated or stored in the liver. And over time, if you continue to do that, okay, there's a potential to actually damage your liver. So excessive consumption of alcohol is actually not beneficial, apart from the fact that it interacts with your medication in some negative ways. If you are diabetic or hypertensive, it is obviously not the best thing to be overindulging in alcohol consumption because your body cannot deal with that excessive energy. And alcohol, the energy you get from alcohol is not something that your body can utilize. It's empty calories.
Yes.
Yeah.
All right. Well, Dr. Maxwell, we're getting ready to wrap up this conversation. But before you go, like you to talk to our viewers and let them know the importance of getting tested for diabetes, and most importantly, where they can get tested.
Okay. Well, it is important to get tested because that is the only way that you will know that you're diabetic. And if it is that you have family members who are diabetic, okay, maybe uncle, daddy, whatever, anybody in your family who is diabetic, or you are obese, you're overweight, you are living a sedentary lifestyle, like you're not active, those are the things that will, kind of trigger you to, go and get tested. The areas where you can get tested, practically every village has a health center. So you just walk into a health center and get tested. If not, you have your private doctors, you can go there, or you can go to any drugstore. Like I'm informed that there's some drugstores who actually test for, sugar, glucose levels. So you can get tested in a variety of it. And there's so many other health fairs that take place in churches and NGOs that people are actually exposed to testing, and they can also be tested.
All right, great. Well, thank you so much, Dr. Maxwell, for being on with us and for speaking about diabetes. I mean, certainly something that, we hear it all the time, but we need to really listen to it because it is one of the non-communicable diseases that are very prevalent within our society, especially among us people of color here in the Caribbean. All right, so we are also going to take a quick break, and when we come back, we'll continue with some more discussions on GMT. Passion start to rise, the energy fill the sky.